Hello and welcome to Health Professional Radio. Thank you for joining us here on the program today. I'm your host, Neil Howard. Our guest is a returning guest. He's joining us today from the Parkinsons Foundation, CEO of the Parkinsons Foundation, Mr. John Lehr. He's joining us, returning on the program to talk about the organization's commitment and their efforts in advancing the training of neurologists who specialize in Parkinson's disease, or PD. Welcome back to the program, John.
Thanks, Neil. It's a pleasure to be with you.
For our listeners who aren't familiar with you, and you were here with us before, a bit of background about yourself, and we'll talk about the Parkinsons Foundation's commitment to fighting Parkinson's disease.
Sure. So thank you again. I appreciate it. So I'm the president and CEO of the Parkinsons Foundation. I've been in this role for almost 2 years now. I come at this role from an entire career in healthcare and healthcare philanthropy, having worked at a number of other organizations, disease-specific organizations in the past. My focus is on helping people with specific diseases live the highest quality of life possible, while we also work on advancing research ultimately toward a cure for those diseases. So my current role, it's really focused on Parkinson's disease.
What is Parkinson's disease for those who may not be familiar with it, as most of our listeners are healthcare professionals anyway, but you never know. What is Parkinson's disease and how does it affect a person's life?
Yeah, so Parkinson's disease is it's characterized as a movement disorder, but it is a degenerative neurological disease that affects 1 million Americans in the United States and about 10 million individuals worldwide. Most people, the reason why I said it's a movement disorder is that the outward signs of the disease are generally around movement. So usually what will bring someone with Parkinson's into a clinician's office, which is a doctor's office, is I'll start to notice maybe a slight tremor in their hand, a resting tremor, where their hand starts to shake or their leg starts to shake. And then as the disease progresses, you can get freezing of gait, where when you're walking, you suddenly no longer can move forward because, your motor function is limiting your ability to walk smoothly and easily. So those are the obvious physical motor symptoms of the disease. But as we've moved forward in our understanding of Parkinson's, what we realize is that it affects almost every system of the body, and that's primarily because Parkinson's is a brain disorder, we all have dopamine in our brains. Dopamine is critical for functioning, and we have a finite amount of dopamine. And for people with Parkinson's, they're coming to the end of their dopamine supply, and so the motor symptoms and the other symptoms that accrue because of that are related to that. And so part of what we try to do in Parkinson's is replace the dopamine. So there's the number one drug is really a dopamine replacement therapy. But when I was saying it affects the other parts of the body, it can affect cognition. It can affect mental health. Depression and anxiety are very common. It can affect the senses. One of the first symptoms of Parkinson's is that you lose your sense of smell. But there's GI issues, there's sleep issues, there's intimacy issues. So, it really is, it's a disease that can affect every aspect of a person's life.
When it comes to treating Parkinson's, because to be clear, there is no cure, do you see advancements towards a cure, or are we still so entrenched in the advancements in treatment with no cure in sight?
Yeah. So I would say, our goal is ultimately to have a cure for the disease. But while we're working toward the cure, and we certainly are working toward the cure, what we're trying to do is mitigate the symptoms and also some of the consequences that accrue from current therapies. So, for example, dopamine replacement, carbidopa, levodopa, can also lead to what's called dyskinesia. So if you've ever seen somebody with Parkinson's who's moving around a lot, like shaking their arms and moving them back and forth in kind of a rapid motion, that's actually not a factor of the disease, but it's actually a consequence of the therapy, the drug that they're taking. So if we can minimize dyskinesia or minimize dystonia, that's where your very painful symptom where your toes curl and other parts of your body curl. If we can work on those symptoms that really affect quality of life, while we're also working on a cure, that really is our approach. The truth is that, as I mentioned earlier, Parkinson's has turned out to be a much more complicated disease, complex disease. It's an idiosyncratic disease, and what I mean by that is that no two people have the same exact course of disease. And so some other diseases are more predictable in their pathway, but that's not necessarily the case with Parkinson's. So there's a lot of different therapeutic approaches out there that we're funding and scientists are exploring. We're hopeful that a cure is somewhere down the road. It's probably a little further down the road than we initially thought. But in the meantime, we're working very aggressively to address quality of life issues for people with Parkinson's.
I do understand that the Parkinson's Foundation is heavily involved in getting the training that neurologists need in order to better take care of their patients. Now, being a caregiver for someone who has Parkinson's and being a healthcare provider for someone who has Parkinson's, it has its own or different levels of stress and responsibility. Now, this is November. It's National Caregivers Month. Talk about some of the ways that the foundation is addressing Parkinson's caregivers.
Yeah, so thank you for that question. So on December 1st in Phoenix, Arizona, we're going to be holding our Caregiver Summit. So it will be an in-person summit, but we will also be broadcasting it to 12 satellite locations around the country. It will be in English, but also in Spanish. And the idea behind this is that, as people with Parkinson's disease progresses, their care partners, their caregivers, it's often a spouse or a sibling or somebody in the family, whether it's a daughter or a son, is often asked to take on increasing responsibility for their loved one with Parkinson's. And so you can imagine, living with the disease is a very challenging, can be a very challenging daily, consequence. But helping to give for somebody with Parkinson's also has its rewards and its challenges. And so the Caregiver Summit really is to talk directly to people and work directly with people and help people who are in a caregiver role for people with Parkinson's to make sure that they have all the resources they need, that they understand the unique aspects of the disease, that they can share with others, techniques and hacks, for lack of a better word, in terms of managing daily events. In the Parkinson's space, buttoning a shirt or lacing up shoes or, just basic, grooming and things like that can be a struggle. And often people with Parkinson's turn to their spouses, their loved ones, their caregivers for support. And, so to the extent that we can help them be best prepared for that, is really important. The other side of the equation is it's not simply just what they can do for people with Parkinson's. We realize how emotionally challenging it can be to be in a caregiver role. So we also want to make sure that people who are in those roles feel supported and know that others are out there. And so it's an opportunity to connect people who are doing that and to, share the joys and also the challenges of performing that role.
But where can our listeners go and learn some more about the Parkinson's Foundation and about the summit that's coming up in December?
Yeah, so they can go to our website, which is parkinson.org. So that's Parkinson without an apostrophe and without an S, .org. So parkinson.org. And then we have a whole site or a whole location on the Caregiver Summit. So if you type in Parkinson's Foundation Caregiver Summit, you'll come up to a webpage that talks all about registration, what's going to take place, the different satellite locations. There's also information in Spanish, so for Spanish-speaking folks, they can take a look at that. So it's all right there. And then if they want to call the foundation to get more information on it, they can call our helpline, which is 1-800-4P-INFO. That's 800-4PD-INFO or 473-4636.
Great. Always a pleasure, John. Thank you so much for coming back and talking with us.
It was my pleasure. Thanks a lot, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.